Okay. Well, thank you everyone for joining us today. My name is Jen Bentley and I'm the Alumni Engagement Officer for the Faculty of Health. I'd like to begin by acknowledging that much of the work of the University of Waterloo takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work towards reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within the Office of Indigenous Relations. Here in the Faculty of Health, we are fortunate to have an Indigenous knowledge keeper, Elder Henry, with us to support us in our learning and creating many opportunities to bring our community together in that learning. So we're fortunate to have that within our own faculty. With that, I'd like to welcome everyone again to our alumni office hour today, featuring Lyracy Francis. Bringing back alumni to connect with our students is an important priority for both the Faculty of Health and the university. We're able to highlight our successes of our alumni and show students what's possible after your time here at Waterloo. So we have been hosting this alumni office hour event series for a number of terms now, and we will continue to do so in the future. So if there are ever any career paths, jobs that you're interested in hearing from, we'd love to hear your ideas or requests. So please feel free to share those with me at any time. You can, if you have ideas today, you can put that in the chat for me, but you can also email me anytime at jennifer.bentley@uwaterloo.ca. So in order to make the most of this small group session, and because it's always nicer to see some friendly faces and have people to talk to, I would like to invite everyone to turn your cameras on if you're able to and comfortable with that. That way Lyracy gets to talk to some faces as opposed to just a bunch of blank boxes on the screen. So appreciate anyone who's able to turn on their video to make this a little bit more engaging. And then when it does come time for the Q&A, we will do that, have like a live conversation. So you're welcome to use the raise hand feature under reactions to ask a question. And I'll just kind of go in order as questions come up. And if you are somewhere where I know sometimes people are at work or you're not in a space where you can come on mic and ask, if that is the situation, please feel free to put your questions in the chat and I will read those out for you as well if that is needed by anyone. So with that, I will let Lyracy introduce herself, but I'd like to pass it over to her to share a bit about her career journey and her time at Waterloo and to where she is now.
Yes. Thanks, Jennifer, for the warm introduction, and hi, everyone. I thought I would prepare some slides as I talk through my career journey, just to kind of help guide my conversation, and hopefully I answer some of the questions that you guys have submitted to Jennifer. Can everyone see my screen? Can you see me advancing the slides? Okay, thanks, William.
Yeah.
So a little bit about me, I guess, just as a quick overview. I am a graduate of the Health Studies program, and I've also recently completed my the Masters of Public Health program from the University of Waterloo. And since my graduation, I've been working as an analyst at the Canadian Institute for Health Information. So a little bit more about my academic and career journey. So I was enrolled in the co-op program at the University of Waterloo, which was a 5-year program. And when I completed my undergrad, I wasn't sure if I wanted to get my master's or go straight into working. And through my co-op experiences, I knew that I kind of wanted to get a job in like the health analytics space. And I at the time I didn't know whether I wanted to do something research-based or a course-based program. So I thought I would like give myself a year. So I started working as an analyst at ChiHi. And yeah, after about a year of working there, I realized that I really enjoyed the work that we do. And I felt that I felt that I was kind of ready to take on the master's program. And at this time, I kind of solidified that I didn't want to go into a research-based program because I wasn't interested in pursuing an academic-based career. So I looked at course-based master's programs, and I really liked the UW one because one, I was really already familiar with the School of Public Health, and I knew that I would be getting a good quality education, but also the program was offered online. So I would be able to continue being employed and to work on my master's. And because of COVID and all the lockdowns that we had in the beginning, I was able to complete my master's in 2 years while working. And that's just because there was like lots of lockdowns and nothing else to do other than to study. Yeah, I'm presently continuing to work at Chi-Hi. So I guess some key takeaways from my undergrad, but also I guess from my master's experience is like the co-op program. Co-ops or placements I found to be extremely valuable. Definitely if you're like looking at master's programs, I would try to look to see if there's like a practicum or a placement component. And co-ops are great because they really help like get you to kind of test out a job before you kind of commit to it full time. So all of my work terms were actually in the public sector, and two of my work terms actually weren't completely related to health at all because for those of you who are in the co-op program, you may know that it is sometimes a little competitive to get a job, especially like in the beginning. However, still able to get a co-op job, but it wasn't necessarily in health, but I still got to learn a lot of hard skills and soft skills. So one of my co-ops was as a business analyst for Toronto Water. So I got to gain some analytical skills there. Another one of my co-ops was at Environment Canada as an administrative assistant. And while that job wasn't necessarily completely related to health, like I had expressed interest in wanting to do something more health related. So like during that co-op, my manager had connected me with like the policy department where I got to like make policy briefs on some of the programs that they had for how health impacts climate change. So that was really interesting. And one of my last co-ops was at York Region Paramedic Services, where I worked as a research assistant. And I did 2 co-op terms there. And this is where I got a lot of exposure to working in a community health unit, to working with data, to doing like data analysis. So that's where I really where I realized, okay, I really like this work. I really want to like try to go into the health analytics space. So after those work terms, I decided that I really wanted to pursue that avenue more seriously. So I took a lot of like health research courses, I would say. So like a lot of the upper year epi courses, the stats classes. There was a class on, I believe it was Health 451. I think it was like health information analysis. I really tried to gain a lot of skills in that area by doing that. And the great thing about the health studies program is that there is a specialization called the health research specialization. And in this, you have to take a bunch of these kind of like methods-based courses. And another great thing about the specialization, but also a great thing about the health studies program is that you're able to do an honors thesis, which is something that I would highly recommend for anyone who wants to pursue a research-based master's program, because it gives you a glimpse of how a master's would look like, and kind of like working independently and kind of like time management, organizational skills, getting hands-on research experience. So I did my honors thesis on a qualitative project because I was already getting so much exposure to the quantitative side through courses. So I did a qualitative study on how healthcare is responding to climate change. So I just interviewed key informants that worked in health departments and asked them what they were doing to address the health impacts of climate change. So that was a really a great opportunity to like have the experience of like conducting research, submitting an ethics application, like working with a professor. So that was like a really good experience, and I think it would suffice as good work experience as well. Another thing that I would recommend is like volunteering. So I don't know how things are with COVID, but there's a lot of volunteer opportunities at the school. So I volunteered with the campus health team with a group called Leave the Pack Behind, and I got a good exposure to like health promotion on the ground. And volunteering is a great way to add experience to your resume. And the last thing that I would say is connecting with professors. So like going to office hours, being an engaged student, asking if you can volunteer in their research labs. And the reason I say this is because like when you connect with your professors, you can kind of like build your network, but also if you are interested in pursuing a master's education, it looks really awkward if you ask a professor for a recommendation letter and they have no idea who you are. So connect with your professors, and it's quite like it's like a low effort task, and I'm sure it'll reap lots of rewards to connect with your professors. So yeah, those were kind of like my key takeaways from like not only from my undergrad but also from the MPH program as well. And kind of like taking my education and going into the career side of things. For my role specifically, or any role in the health analytics space, I would say you kind of need to develop your skills, like those hard skills, in addition to those soft skills as well. But hard skills in terms of like getting a good grasp of like statistics and basic epidemiological principles, like knowing about study designs, but also being able to like utilize programs like I would say Excel and R are really important. At ChiHi, we use SAS, but we're kind of phasing out of using SAS, and we're getting into using R and Python. And I would say like when I applied for the job at ChiHi, the only SAS and R experience I had was through school, like through courses in from my undergrad. And there's a lot of like self-learning that you could do as well. There's a lot of courses that you can take to kind of build those skills as well. Another thing that I would say is kind of have like a portfolio of things that you've worked on. And this could be things that you could highlight in your cover letter or your resume, or even during an interview to talk about um, how you were able to perform an analysis or do a research study or do a literature review. And I think people take those school assignments for granted, because a lot of the times when you're doing these school assignments, you forget that they have like that they can be applied and used in real life. So like one of the things that I remember for in my undergrad, when I took that health information analytics class, I believe the professor was John Hurdy's. I'm not sure who teaches that class anymore, but we had to like we were given a data set and we had to like conceptualize a research question, analyze the data, and like basically present the data in the version of like a PowerPoint, and then also like create like an infographic fact sheet type of thing. So I remember I had actually like spoke about this assignment in my cover letter, and then like during interview when they would ask like describe a time where if you've had to conduct an analysis, you could talk about these school examples. So kind of just have like a mental list in your head of like things that you could talk about. And then the other thing is like getting that experience. So whether that's through co-ops, placements, or practicums, or even like volunteering with the professor, your master's, if you want to like if you pursue like a research-based master's program, you gain a lot of experience there as well. And then the last thing that I wanted to say is having a good resume and cover letter. So I wouldn't dismiss like the Center for Career Action. I believe that they offer like resume building workshops, and I've attended them and I found them to be extremely helpful. So just utilizing those resources were really helpful for me. And then I noticed there were a lot of questions on like what I do day to day in my job as an analyst at CaiHi. So I would say like a big part of my job responsibility is um, helping to support the development of analytical products that answer questions that we have about the healthcare system. So a lot of that is like data analysis, like data manipulating, data sources, gathering the data quality. So if we have, like after we've conceptualized a research question or there is direction from our stakeholders or like thinking about the landscape of healthcare and what are pressing things, that's kind of like what informs our analysis. And then as analysts, we're kind of responsible for gathering, like figuring out which data sources we would use, how we would perform the analysis and all of that. So that can take a lot of time to do. And then the other thing that we do is kind of conceptualizing that data. So whether that's doing literature searches, reading different reports, finding complementary data products to kind of like tell a story with our data. And then finally, a big part of our work is kind of actually developing the analytical products that that our stakeholders use and see. So that's like the writing, the drafting, the creating of the infographics, etc. So I thought I would like show a quick example of like one of the projects that I've worked on at CaiHi. So this is the landing page of our impact of COVID-19 on healthcare system. So this was a project that was driven by the nature of how healthcare was due to COVID. So there's a lot of avenues of how the healthcare system is impacted by COVID, and a bunch of our analyses are highlighted on this page here. But the one with the box over it on emergency departments was one that is one that I helped support. So we wanted to see how emergency department visits were impacted by COVID. So for that, when we're thinking about analysis and gathering our data sources, it was just like, what data do we have available? And at CaiHi, we hold a data set called NACRS, the National Ambulatory Care Reporting System, which is basically a data set that has emergency department visits. And then we basically analyzed that data. We looked at how many visits there were during the pandemic, and we compared that to before the pandemic. We looked at which conditions people were coming into the ED for. We've like looked at age and sex breakdowns. So that was like the analysis part. And then conceptualizing the data was kind of like taking the data that we've analyzed and like kind of packaging it in a way that would be like digestible and understandable. But also kind of like finding research and looking to other organizations to see how we can complement our data. So one of the things that we found in our data was that visits for pneumonia and flu dropped drastically during COVID. And upon reading literature, we realized that this is because a lot of individuals were complying to public health prevention measures, such as like masking and hand washing. So that drastically decreased flu volumes. So we were able to cite those pieces and kind of conceptualize the data that we have. And then finally, like the development of the analytical products. So it's us deciding what data we want to make available for our stakeholders and like creating infographics that'll kind of summarize your data really nicely. So if you actually click on the emergency departments thing, it'll bring you to another landing page where we have a blurb about summarizing our analysis, and you're able to download data tables that has like emergency department visits by day, breakdowns by age and sex, and what clinical conditions they came for and like how long they were waiting in the ED and things like that. So that's kind of like currently my role as an analyst in a nutshell. And that kind of concludes everything that I thought I would talk about for this part of the office hours. And yeah, I'm happy to answer any questions you guys have. And I hope you guys found this a little helpful. Yeah, I'll stop sharing here.
Great, thank you so much. You covered a lot of content there, and Yeah, I think you started us off with a lot of great information. I see William is already ready with a question in the chat. So thank you, William, for that. I'll read that in 1 second, but I will invite people to turn their cameras back on and be a part of the discussion now with Lyracy. And I'll start things off with William. Would you like me to read that question for you? Yeah. So he asks, in your Kai-Hi job interview, did they have a coding challenge component? And if so, how should one prepare for that coding challenge?
I wouldn't call it a coding challenge, but typically for health analytical roles, there will be an assessment component. So you'll have, and sometimes it'll be like you'll do your interview and then they'll ask you to do the assessment. Or sometimes I've been to interviews where they use that assessment as a screener before you get to the interview phase. So there is a quote unquote coding component to my Kai-Hi interview, but also that's not something unique to Kai-Hi. I know a lot of companies will have something like this. And in terms of how you should prepare for that, so I guess like at Kai-Hi we use SAS, so that's currently what the assessment would be on. So it would just be like brushing up on stuff that you've learned in school. Generally, I found that these assessments don't ask you very complex, complicated things to do because you have such a short amount of time, and really they just want to get a sense if you know the syntax, if you know what to do. And if you don't know SAS, there's an like at Kai-Hi, at least I know, they let you like write it in a different language, and then you can kind of explain like this is how I would do it, I guess. So yeah, I don't know if that's answered your question, William, but
Great, thank you. Good question. Sounds like you're already preparing yourself for opportunities, which is great. Does anyone else have a question they'd like? Oh, Juliet has one in the chat for us. Oh, everybody's in the library. Well, I appreciate everyone still joining. So I'll just read questions from the chat for anyone who needs that. So Juliet asks, how did you balance working while completing your MPH? Did you work full-time and study part-time or vice versa?
It's a really good question. I think for me, and people in my cohort, we got a little lucky because when we started our master's program, it was in September 2020. So we were still in and out of lockdowns. So I did continue working full time. And there were semesters where I did did take a full course load, which was 3 courses, but there were semesters where I found it too exhausting and too draining. So I switched to part-time. So the MPH program does offer that flexibility. You would just have to speak to your academic advisor and figure out what's good for you. But I found because I found it to be doable, and I know a lot of people have, but again, it's completely dependent on your life and what priorities you have. So like I'm a young professional, I don't have a family. I felt like I didn't have any priorities outside of work. So it was very easy for me to and we were working from home as well. So I didn't have to commute or anything. So 8 to 4, I would work my full-time job, and then I would take a break, and then like from 5 to 10 I would just do stuff for my master's, and yeah, weekends were gone to working on school assignments. But yeah, there were semesters where I found it a little challenging to balance things, and I just would switch to part-time.
Great, thank you. Oh, Juliet typed that as I said it out loud. So next question we have in the chat from Abdul Hannan. How much coding do we need to know to be proficient in a general health analysis field? A friend of theirs said that Python was enough. Many of us have never touched coding in health sci.
Yeah, so that's a good question. I would say, like when you finish school and you start off in your job, I think employers know that it is a very hard expectation for someone to be an extremely proficient SAS or Python coder. I think that comes with time and experience. So I would say don't feel bad if you don't have a ton of experience, because it's hard to get that experience when you're just out of school. Um, so um, I would say like being a beginner in any program should be sufficient. And like I said, like I only knew SAS from the courses that I had taken in my undergrad. And what's great about Chi-Hi and a lot of other organizations is they'll kind of help you bring you up to speed on some of these programs. So when I was at Chi-Hi, I took courses at the SAS Institute, where I was able to kind of become more proficient in my SAS coding skills. Um, and yeah, I would say like if you find that you don't have the opportunity to touch any kind of coding in health sciences, I would say reach out to a professor. Perhaps there's research opportunities that you can kind of and like that you can take on, and that's a great way to like learn how to use SAS. So just like volunteer at like research labs, and then like pursue courses where there is a SAS component to it. So I know in my master's program, there was courses where we've had to use SAS and R. And in my undergrad, I even remember in the EPI class, we had to use SAS and R as well. So I would say pursue those courses to get that experience. I don't know if I've answered your question, Abdul, but
Great recommendations, though. Okay, well, I'll just keep going through the chat. Oh, Abdul gave you a thumbs up. We're good. So William had another question asking, besides looking at Chi-Hi's career page, where else could students find info about employment opportunities?
for Chi-Hi specifically, or just in general? Oh, for Chi-Hi specifically. To be honest, I believe they only have their employment opportunities page where they post like normal jobs, like for analysts and senior analysts, but they also post co-op jobs and practicum jobs. So I would just say looking at their employment opportunities page would be a good place to start.
Great. So then Bristy asked, if you have knowledge in research, say this is a career change you're considering, what should one do to gain the practical experience to be more qualified to work in data analysis?
So you're asking like what kind of practical experience to get for a field, and okay. I'm trying to think. Well, of course, like doing school is like taking those kind of courses, like EPI courses, stats courses would be helpful. I'm also thinking if you're kind of done school and you're trying to get into the data analytics field, but you feel like you can't, maybe pursuing a master's might help, especially if you do a research-based master's, so you can get that hands-on experience with data analysis, like pursuing something more quantitative. But also I feel like if you're really self-motivated, you can take on a lot of like self-learning courses. Like I think LinkedIn Learning has a lot of courses on R and Python. And then maybe even reaching out to old professors to try volunteering to get that practical experience, I think would be helpful.
Great. And she did ask a second question. Christy, let us know in the chat if she answered all of your first question. But then next she asked, where do you see yourself in your career journey in the next few years? If you've thought about it.
Yeah, I definitely see myself being in the data analytics space in the next few years. The great thing about health is that I feel like you'll never be bored and you're never going to be facing the same problems or challenges. So in the next few years, I definitely do see myself being here. And the great thing about analytics is that there's so much to learn. And I find that I'm always learning new things. So I really want to get into like doing more like spatial analysis, so like with GIS. So just like really broadening my skill set in the same space I think that's kind of where I'll be. And I love working at CIHI. CIHI is such a fantastic place to work. So yeah, hopefully it's still there, just with more analytical skills, I guess.
Great. As I work my way through the chat here, there's a nice comment, not a question, but a great comment from Bradley, who just shared that he's a lead in data engineering at the SCORE, and a Bachelor of Public Health alumni. But he's offering, if anyone has questions or needs help with Python, that he'd be happy to help them out as well. So again, another great benefit to these sessions is the networking that can happen. If there's anyone interested in that, we can maybe send Bradley a private message, or Bradley, if you want to put your contact info or LinkedIn in the chat, that works. Liercy, I have your LinkedIn as well, if you are open to me sharing that with the group. Great.
I might reach out to Bradley myself too.
There we go. See, it's all about making connections and helping each other out, which is why I love hosting these sessions. So I'll keep going through the questions. Looks like everybody's out and about in their day, which is great, but everyone took the time to join us. So Paige asks, which professor did you work with for your thesis, and how did you go about connecting with these professors? I'm interested in doing a thesis, but haven't had the opportunity to connect with many professors due to COVID. How would you recommend connecting with professors other than office hours?
Okay, that's a really good question, Paige. So I remember for myself, what I had done was like a few months before I started a few months before I started the honors thesis course, what I had done was I tried to narrow down what topic and area that I would like to focus my research on. And then I just went to the SPHS like professor list page. And then I tried to narrow down which professors had similar research interests as myself. And then from that list, I looked at, okay, which profs did I have classes with? And that's kind of how I went about connecting with professors. And I would just like send them an email and just say, I don't know if you remember me, but I took X and X class with you, and I'm really interested in pursuing like my honors thesis, and like this is like kind of like what I would like to do it on. Do you have time and the capacity to support me? And then professors that I hadn't had a chance to connect, like if I didn't have a class with them, I would just format my email a little differently to them. And I actually worked with Dr. Craig Janes. I hadn't had a class with him prior to this. And yeah, I just met with the professors, and then I just picked the project that I liked, and then that's kind of how I went about it. So sometimes it is just about cold emailing, which I know can be a little awkward and uncomfortable, but I think professors know that there are undergrad students who want to pursue theses, so don't ever feel like you're bugging them or anything, because it's their job to teach us. So yeah, go ahead and do those cold emails, even though it might feel a little uncomfortable.
The other thing I'd love to offer as well is that people like your academic advisor, Ashley King, I think is on the call still, and she's going to hear me say this, so hopefully she can back me up on this, but she works with a lot of the practicum or the master's and grad students. But even, those staff, even myself, even though I'm the alumni engagement officer, I know a lot of the professors as well. And so feel free to ask like another connection that you have, like your academic advisor, if there's someone you'd like to meet, we can help make those introductions for you if that's helpful. Ashley, do you have anything to add to that?
No, I think you summed it up pretty well. And I think it's just really trying to figure out who has the same interests as you and then seeing what opportunities exist. And oftentimes, if they don't have the capacity to support a student, they might themselves, a faculty member, might reach out for you and connect you with somebody else who might be able to take on a student or might have interests that more align with yours. So I think it doesn't ever hurt to try to connect with them and reach out to people and just see where it leads.
Mm-hmm. Yeah, we're all here to help and support. So just find a friendly face in the hallway and start there.
Jen, can I ask a question?
Sure. Yes.
Clear
Go
C,
ahead.
would there be anything you would do differently in your journey? Anything you would have changed looking back on how everything went?
That's such a good question. I hadn't thought about that before. What would I change?
Maybe to go with that, someone also asked why you chose like your undergrad at Waterloo and to do
My master's.
Yeah. So if there's anything that like leads to that, but that you would have done differently or how that all panned out.
I guess if I wanted to pursue a more academic-based career, then I think I would have chosen maybe like the MSc program at Waterloo in public health as opposed to the course-based master's program. But I knew, and I'm glad I took the time. And if I didn't take a year off between my undergrad and my master's, I think I would have pursued a research-based master's program. But I'm really glad that I took that time to see what I wanted to do. Because after working in the field for a year is kind of when I thought, okay, like I don't want to, like academics wasn't for me. And I got a little bit of exposure and taste to that doing the honors thesis, and then working for an additional year kind of solidified that, okay, I don't miss the research world and that I want to pursue something like working in more project-based work. So I think like looking back, if I maybe things would have been different if I just went straight into doing my master's, because I imagine I probably would have done something more research-based. And then I think my career trajectory would have looked a little different. But yeah, the MPH program at Waterloo is fantastic. Even though the program is online, I really found that the profs made it really engaging. So like you're still able to connect with students and network with them, and still like got a lot out of it. So I wouldn't dismiss, just because it's an online program, I wouldn't dismiss it. I thought it was a fantastic program. And yeah, I think I chose Waterloo in general coming out of high school. The co-op program really attracted me. So I don't know if I've answered that question well, but.
That's perfect. I have one more for you. I know that CAHI is a really popular site for practicum students, co-op students, and for people who are just graduating from their undergrad and graduate program. What are some more of the entry-level positions that are available at CAHI for people who are just graduating and want to get some work experience before either deciding to go back to graduate school or just want to see if this is the place that they want to work?
So I think at CAHI, the entry-level positions, we have analysts and senior analysts. So the entry-level positions are for analysts, and I believe they require 1 to 3 years of work experience. But if you're not analytically oriented and you're more interested in like project management and project coordination, but you still like the health health analytics world, but you're not totally into the data, we do have coordinator roles. So we have coordinators as the entry-level positions and then senior coordinators. So that's like if you still want to stay in the data space, but you don't want to do the analysis, that's an option. And I believe we also have program specialist roles. I'm not sure if these are entry-level positions, but they're more so people who are knowledge and subject matter experts in specific programs that we have at CIHI. So like we have like the Canadian Joint Replacement Registry, and these program specialists would be responsible for data intake and making sure we've got the data from the facilities. Or I believe they're either called program specialists or data coordinators. But those are kind of like the roles that we have at CIHI. And yeah, CIHI is a great like practicum co-op placement program as well. I've interviewed for co-op positions at CIHI before, but I was never successful in getting them. So I'm glad I was successful in getting the full-time one.
Thank you. And great questions, Ashley. Seda, I wanted to come to your questions. Did you want to come on mic and ask them yourself?
Hi, yeah, sure. Thank you very much. So I wanted to know if you were able to, if you could change the full-time to part-time, would you still be able to finish the program in 2 years? And thank you very much for coming today, Darcy.
Oh yeah, no problem.
Really appreciate it.
For asking your question. I was able to complete it in 2 years, but I think that's because like for one part-time term, you're allowed. So if you're part-time, and Ashley, correct me if I'm wrong, because I could be wrong here, but when you're part-time, you're only allowed to take one class for the semester. But I believe you're allowed to take 2 classes for one term if you're part-time.
That was just for your cohort because there was a scheduling issue. So
Okay.
I would say it really depends how many courses you take while you're full-time, because some full-time students take 2 courses per term, some full-time students take 3 courses per term.
Yeah.
So it depends on how many courses you take per term, if you can have maybe one semester as part-time. But often if you want to complete the program in 2 years, you have to be a full-time student for those 2 years. If you want to complete the program in 3 years, then there are some terms that you'd be able to go part-time for some terms and full-time for other terms. And then if you want to do the program in all part-time, then you would be looking at 4 years for the MPH.
Yeah, so to be honest, like I did find it to be quite draining and heavy doing full-time work and full-time school. And like I said, the only reason I was able to do it was because we were on lockdown for like a good 8 months. So I had nothing else to do. And I think a lot of people who have similar life experiences as me that were in the program were also like, that was the reason why they were able to continue working and studying. And so I would just say like prioritize your mental health. Don't like pressure yourself to get it done. I don't think there's like don't try to kill yourself like doing full-time school and full-time work. Just do whatever works best for you.
Thank you very much. I do have one more question, if that's okay. So regarding to get a successful student placement, is there any suggestions that you have that work for you that you could share it with us? Like,
Yeah. I think like when I was in co-op and I didn't have work experience, it was really hard to like sell yourself to get that co-op placement. And I think that's where you can really highlight skills and experiences that you have from your courses and from courses that you take. So I think like really like if you're interested in pursuing like a co-op in data analysis, then I would say try to take courses where you can gain those skills to kind of help you sell yourself. So I think like that would be something like to set yourself up for success, but also like I know and if you're looking for a co-op job, I know like connect with your academic advisors, like with Ashley. I think I can't remember what it's called. Waterloo Works has a whole plethora of job opportunities. So just like keep at it and keep on applying to jobs. And sometimes if you're not like successful in getting the job, or you find you're not like hearing back, maybe even setting up informational interviews with people might be helpful to see like what they did and how they got there. And people are always more than happy to share their experience. So yeah, I hope that helps.
Thank you very much.
Great. We've got a few more questions in the chat as we're getting close to 2 o'clock. So Aaron asked, how did you balance completing your thesis, volunteering, and schoolwork while completing undergrad? And also, are there any undergrad courses that really stood out to you, like your favorite courses?
So yeah, that final year I remember was really stressful because yeah, the honors thesis, doing all the coursework amongst volunteering. So I would just say like managing your time really well was something that helped. And yeah, just prioritizing, having good time management and organizational skills. And this is like school's a great time to learn those soft skills because they'll really translate when you go into the workplace. So yeah, I guess just time management in terms of like balancing all of that. And in terms of undergrad courses that really stood out to me, I don't remember the course codes and I don't know if they've changed, but the two fourth year EPI courses I found were really helpful. So that was the non-communicable and communicable diseases for epidemiology. Like both of those courses I found really helpful, and I have both like course notes from both of those classes, and sometimes I actually go back to them for whenever like at work, if I need to like figure out what sample size I need, like sometimes I'll actually physically go back to those course notes. And then the infectious disease course was really cool because I had taken that course in like 2019, and then when COVID broke out, it was like the class playing out in real life. So I really liked those courses. And then in the EPI course, the non-infectious disease course, I believe that was taught by Dr. Mark Aramis. We actually got, in our assignments, we got to have practical experience using SAS. And I think for one of the assignments, we had to use R. So that was a really good, those were like courses that I found to be really helpful and useful. And then the last course that I found was really great was, I think it's Health 451. I'm not sure. I believe it's called Health Information Analytics or something like that. It was taught by Dr. John Hurdes, and that class was great because yeah, we got like he gave us inter-eye data, like data that ChiHi has as well. And we were able to like do assignments with real life data. So that was a really great course where we got to have those experiences and skills. So that was a really good course. I'm trying to think about other ones, but nothing comes to mind, but hopefully that answers your question.
Such great questions today. I love it. Good content for you, for everyone. We've got one more question in the chat here from Hannah, who asked, did you develop any skills that you think helped you get this job at ChiHi that perhaps you were lacking when you applied for co-op?
Yeah, so like in the beginning co-ops, like in the beginning stages of my program, I didn't have the analytical skills, but as the years progressed, you take more courses and you gain more work experience and exposure. So all of that kind of builds up to how I applied for the job at ChiHi. So I think it's just a journey. Like it's going to be hard to get everything, all the skills and experience you need in one go. It's going to take some time. And I think like incrementally, you'll kind of, you'll get there through doing more experience, through those co-ops and the more classes you take. So yeah. Mhm.
Okay, great. So we have about 8 minutes left. Anyone have any more questions? I'll take a quick look at the questions that were submitted during registration to see if there's any more that we want to grab. Sorry, I was trying to find a specific question here. Now I can't find it, but someone had asked just overall what advice you would have for maybe kind of two separate groups. So undergrads as they're finishing up and trying to get that first job out of undergrad, and then also like once they gain a bit more experience, maybe getting a job after you finish like your master's level education.
Yeah, I would say just like be patient, keep at it. It's not the end of the world if you don't get a job. Everyone gets a job at the end, so don't stress yourself over it, and just and if you find it to be really challenging, I would say just use that time as kind of redirection and refocus to either like do self-learning on like any data and like analytical software. So yeah, I would just say just be patient, you'll get there. Yeah.
I just found another question that I thought sounded really interesting and is a bit more general, but what would you identify as the biggest pain point in the health data world?
Oh, that's a good question. I guess it really depends on where in the data world you're working. So at ChiHi, we get really clean, crisp data sets as analysts. Like the data comes from facilities or wherever they're collected. And then there's a great group of people at ChiHi that really clean it. So when it comes to us, it's just like this really nice, pristine, clean data set that we don't have to we can just like kind of start analyzing and just be aware of some data contingencies. But I did work at a public health unit, and during one of my co-ops was also for York Region Paramedic Services, where the data quality is just not there. So sometimes your boss will ask you to do something, and like something as simple as like how many like ambulance visits were there by month for a certain city. So it's like a simple frequency, but when you go in to look at the data, you'll realize that the dates are not all formatted correctly. So something as simple as a task that should take you like less than an hour to do can turn into a whole day. And sometimes that can even turn into a whole project itself. How can we improve data collection? So I would say like that's a big piece of a challenge is like, especially if you're working at a localized like regional health unit level, that sometimes the data quality might not be there. And I think at ChiHi, something that we struggled with pre-pandemic was the timeliness of our data. And I think COVID has really changed that because we realized that we need to have more timely data. So before, if you look at previous reports, like if we released a report in 2017, it'll be based off of data from like 2013, for example. So the data is really old and it may not hold true today. However, I think COVID really kind of pushed to have more timely data. And so now ChiHi has been a lot better at and the reason at pushing out products a little bit more faster so we can have more timely data. And that was highlighted in a lot of our COVID projects, is to kind of push for more data that can be actionable to our stakeholders. So I think those are things that are sometimes a little bit of pain points. Yeah, hopefully that, I don't know who asked that question, but it's a great question.
Great. Thank you so much. With that, we're getting close to 2 o'clock, so I think I will wrap things up here. But again, Lyracy's contact information is in the chat. I believe you had your email up on the last slide, but maybe if you want to put it in the chat as well, just in case anyone didn't write it down at that moment, we can put it there for anyone who would like to connect further with Lyracy. But thank you so much for taking the time to be with us today, Lyracy. It's been great. You've had great advice and information to share with the group. It seems like we've had a collection of some students, grad students, alumni here today. So thank you to all of you for taking the time to join us and learn from Lyracy and hear about her story. I'll wrap up just by saying you will get an email in your inbox to give some feedback on today's session. So it's a quick choice of smiley face emojis. So if you can take, 30 seconds to give some feedback today, that would be great. It helps us with our future planning. And again, if you have any requests for other careers you'd like to hear from, please feel free to include those or put them in the chat, as I'm happy to arrange, the right people for our students and alumni. So thank you all so much for joining us today, and we hope to see you at our November series of alumni office hour events. So have a great day, everyone. And Lyracy, you can stay on the call.